My case presentation is about a patient named Mary Gonzalez. She's an 11-year-old Hispanic female, and her name has been changed for the purposes of privacy for this assignment. Mary presented to the clinic accompanied by her mother with a chief complaint of burning with urination. The patient states that her symptoms started about 2 days ago, and she states that she noticed burning with urination as well as change in odor to her urine. She denies any other symptoms. She denies fever, abdominal pain, and hematuria. She denies nausea, vomiting, and diarrhea. She does report that she has been constipated for approximately 2 weeks, and she reports her normal bowel movement pattern is about 2 difficult to pass stools per week with no blood or mucus. Past medical history: the patient's mother reports that the child has a history of intermittent asthma, mild intermittent asthma, which is controlled by a PRN albuterol inhaler. Patient and mother deny any other past medical history. Medications include the PRN albuterol inhaler, and the patient and mother deny any use of any other medications. The patient has no known drug allergies. I did collect a brief diet history, 24-hour diet recall due to the fact that the patient has been constipated, which could be contributing to her urinary symptoms. Patient reports drinking little water each day and little whole grains and fiber. Patient's mother reports the typical dinner is a fast food meal. Typical breakfast is a glass of milk with Pop-Tart, and typical lunch is peanut butter sandwich with a cheese stick or some fruit. Patient reports that she will take multiple bubble baths per week, and she does wipe front to back whenever asked about cleaning and hygiene. Patient is up to date on her immunizations. She has no surgical history, and there's no relevant family history that's related to the chief complaint. Physical exam: cardiac exam reveals S1 and S2 with no murmurs, rubs, or gallops or arrhythmias noted. The lungs are clear to auscultation. Abdominal exam reveals normal bowel sounds in all 4 quadrants. No abdominal tenderness, hepatomegaly, or splenomegaly was noted. Brief exam of the external genitalia was performed with no irritation noted on the urethra or the vulva. Patient's weight is 45 kilograms. Diagnostic testing: we did do a urinalysis, which revealed positive nitrites and leukocytes. So for the assessment, most likely diagnosis is an uncomplicated cystitis given the results of her urinalysis. Treatment with ceftonir 300 milligrams for 5 days will be the treatment regimen, but at first a urine culture will be sent out for analysis before the antibiotic is started. An adult dose was chosen for this child due to the fact that she can swallow pills and in regards to her weight. Education was provided for increase in fiber and water intake to help with constipation. Patients to consume 20 to 30 grams of fiber per day, and she's to follow up if she has no improvement in her symptoms or in constipation in the next 2 weeks. Patient also educated to wipe front to back and to no longer take bubble baths, since that seems to be irritating her. Another differential diagnosis would be a complicated urinary tract infection, but given the fact that the child is afebrile and has no other pain, this diagnosis is unlikely. Another differential diagnosis is urethritis. Patient could potentially have urethritis due to the fact that she's been taking bubble baths in addition to her UTI, but there was no irritation noted on exam, but she could still have urethritis due to the fact that she has been taking multiple bubble baths per week. So for reflection, this case was a great example of uncomplicated cystitis. It also provided an opportunity to provide the patient with education regarding hygiene measures, as well as other things that could be causing the symptoms of dysuria, which is constipation, and making sure that these things are taken care of and educated with the family. It was a great opportunity to be able to choose the appropriate antibiotic, what's first line, be able to calculate a dose for the pediatric patient, and understand that she was in need of an adult dose. So I hope that you've learned something from this case presentation, and I thank you for watching.